Assalamu alaikum warahmatullahi ta'ala wabarakatuh. Surface anatomy of the heart. As you know, the heart has four borders: superior border, inferior border, right border, and left border. When we need to draw the heart on the outer surface of the chest, first determine the superior border. The superior border of the heart, represented by line, extend from the point that locate at lower border of the second costal cartilage to the upper border of the third costal cartilage. This is upper border of the heart. The right border of the heart can be represented from the line, represented by line, extend from the third costal cartilage to the sixth costal cartilage, close to the sternum. When we draw this line, it is slightly convex to the right. The inferior border draw from the sixth costal cartilage to the point at the midclavicular line at the fifth intercostal space. This is lower border of the heart. The left border of the heart correspond to the line connect the left end of this line, the inferior and superior. So the left border extend from the fifth costal cartilage here to the second costal cartilage. Again, the superior border from the second costal cartilage 2 centimeters from the sternum to the third costal cartilage close to the sternum. The right border from the third costal cartilage to the sixth costal cartilage. The inferior border from the sixth costal cartilage to fifth intercostal space at the midclavicular line. The left border from the fifth intercostal space to the second costal cartilage. The valves of the heart. All the valves of the heart located behind the sternum. The tricuspid valve located behind the midline of lower part of sternum. The mitral valve located at the fourth intercostal space, just slightly above and to the left of the tricuspid valve. The aortic valve located behind the left border of the sternum here, at the level of the third intercostal space. Slightly above to it is the pulmonary at the left border of the sternum at the level of third costal cartilage. Again, at the level of the third costal cartilage is the pulmonary. The third intercostal space is aortic. The fourth intercostal space is mitral. Behind the lower end of the sternum is the tricuspid valve. Okay? For auscultation of the valve, When you want to listen the valves, at the fifth intercostal space at midclavicular line here, at the fifth intercostal space, left fifth intercostal space, midclavicular line is the mitral valve. To hear the tricuspid valve at the same area at the same area at the lower end of sternum. This is tricuspid valve behind the lower end of sternum. Tricuspid is at the fifth intercostal space as midclavicular line. This is the site for auscultation of mitral valve. At the second intercostal space, there are two valves. On the right side, there is aortic valve, and on the left side, there is pulmonary valve. So, to auscultate or to hear the pulmonary valve at the second right intercostal space. At the second right intercostal space, here is aortic. At the second left intercostal space, there is a pulmonary valve. Midclavicular fifth intercostal space, mitral. Behind the lower end of the sternum, this is tricuspid valve. Thank you very much.